conversation. When people are not wanting to take medicines, I usually suspect a couple of different possibilities. One, of course, is side effects. They don't want to take their medications because it's causing weight gain, or it's causing my hands to shake, or it's causing me to urinate a lot, or I have a heavy feeling, or I'm tired all the time, and I don't like that. Sometimes it's because they forget. They forget when they're supposed to take their morning or their evening dose. One of the simplest solutions to that is some of these medications can be taken once a day, but you may not know that unless you have that discussion with your doctor. For some people, the issues have to deal with family relationships. And this particularly comes up if you have, say, an 18 or 19-year-old person with bipolar disorder who's living with his parents. Say he's dropped out of college and gone back to live with his parents and is now feeling unpleasantly like a kid again. And taking medicines makes him feel like he's under his parents' thumb. So to give you an example, I had an 18-year-old kid I worked with who his mother was very worried about him not taking medicine, so she would follow him around the house. Did you take your lithium today? You seem upset. When we were watching that movie the other night, you laughed awfully loudly. You were agitated this morning. Maybe you need more lithium. He started torturing her by leaving lithium tablets all over the house. And he left them he left them behind the toilet, he left them on the counter, he even left them under her pillow. And needless to say, you can guess what the issue is. He couldn't take the medicine if he felt he was doing it for her. He felt that this was somehow putting him in an immature position. She was rightfully worried that he wasn't taking them. They negotiated an interesting solution. I tried to help them negotiate it, and I came up with a bunch of solutions that didn't even come close to working for them. What they came up with was much better, which was that she'd leave the tablets out for him. There was only 4 he had to take during the day. She'd leave them out on a plate. He would agree to take them during the day. She got access to his monthly lithium level report from his doctor. And other than that, they weren't to discuss it. It was up to him to take them. And that, for them, worked pretty well, and they came up with it themselves. So sometimes it's important to take it out of the context of an autonomy battle. This can also happen with spouses, and sometimes it happens the other way around. So, for example, you'll hear I remember hearing a man say to his wife had was taking, I think it was Zyprexa, and had gained a lot of weight, and he said to her something like, you know, we used to have a great sex life. Not anymore, I guess. And this was his way of saying, I liked you better when you weren't taking medicines. A father said to his 17-year-old son, you used to be such a great basketball player, now you're taking Depakote and you look like a spaz out there on the basketball court. Needless to say, he wasn't behind the medicines. And often when someone won't take them, it also reflects an ambivalence in the family as a whole. That's something therapists have to be aware of. Sometimes the issues have to do with, I'm a painter, I can't have my hands shake when I'm trying to paint, or I'm trying to do very delicate work with my hands. That might require a change in medicines or a change in dosage. For other people, the issue is even deeper. Grieving the lost healthy self, we call it. Remembering how I used to be before I became ill. I used to be healthy, I used to have friends, now I'm taking medicines and everything's changed. So you can see how something like taking pills can take on a lot of symbolic significance, and the family gets involved very quickly. If any of you have a teenager who's taking medicines, I can tell you that whether or not they should be in charge of the medicines really depends upon the age of the kid and the maturity level. When kids turn 16, 17, and 18, I like to encourage them to take responsibility for their medicines little by little, so filling prescriptions rather than having their parents fill it, calling their doctors to change appointments, remembering to take the pills by setting an alarm on their cell phone. But younger kids are not able to handle it yet. They still need a parent to dole out the pills. So it's a kind of a careful negotiation one needs to do based on the cognitive functioning of the child. And you can give them too much responsibility too quickly. Let's talk about mania prevention. I mentioned the importance of knowing one's prodromal signs. What we encourage every family to do, if you have a person who has bipolar disorder, who's had manic episodes, is to develop a contract where when prodromal signs, early warning signs, first appear, the family has a set of steps it takes to try to keep the person out of the hospital. And that person should be very much a part of that contract. So if we know that when he starts talking louder, staying up later, and calling people all over the country, that's when we know he's getting manic. We know that there are certain things that we can do. We can help him get to sleep on time. We can call up the physician, get a change in medications. The person with the disorder may have very strong feelings about who is involved in that plan. Maybe mom shouldn't do it. Maybe it should be uncle, or maybe it should be brother, who they can hear this kind of thing from. There has to be an agreement. The therapist might get involved. The emergency contact information should be in a place where you can find it. Nowadays, it used to be that you'd have to call your physician and get them on a weekend or whatever to try to get the medicine changed. Nowadays, many physicians are writing the prescriptions in advance and saying, well, if you get manic, if you have these prodromal signs, I want you to take an extra risperidol, or to increase your dosage of lithium by this amount. And that can all be worked out ahead of time, but that discussion needs to occur. There needs to be a contract about what do we do. How do we keep stress in the home structure? How do we make sure everybody gets to bed on time? More practically, if this is a young adult or a teenager and they're manic or getting manic, I encourage them to take someone along with them when they go out at night. So instead of going out at night by themselves, to bring a friend along, or an older brother or a sibling or a cousin, someone who's going to watch over and make sure they don't make foolish decisions. If they are having trouble with their car, so I have had patients who've told me every time I get manic, something happens with my car. I get in an accident, I get arrested, I get a reckless driving charge, I get a drunk driving charge. Can they give up the car keys until they're stable? They won't want to, but they may agree to it ahead of time. We tell them about the 48-hour rule. If you have a plan you've hatched for changing your life, I'm going to move to California and become a rock musician. I'm going to go to Congress and tell them how to handle the budget deficit. Any of those things, we tell them wait 48 hours and check it out with 2 people you trust. See if they think it's a good idea. If it's a good idea now, it'll be a good idea on Thursday as well. Try to build in some delay of gratification, as we're fond of calling it when someone is getting manic. Communication. This is a picture that was given to me by the parent of a 16-year-old. I had asked her what's it like to have a 16-year-old with bipolar disorder. She said, well, here it is. That's me on a string. My son is like a big baby puppeteer, keeping us all on a string with his vicious mood swings. Worst of all, he seems delighted that he can do it. Many parents feel very disempowered. They feel like, particularly if it's a teenager, that their whole family has been taken over by this person's mood swings, that they can't pay attention to their other kids. The siblings feel like this is taking, that my brother's nonsense is taking over the family, and the family doesn't seem to understand he's faking it, or he's getting away with murder, and nobody cares about me anymore. Parents often disagree about how it is that the person should be addressed, or how they should be talked to, or how we get them in to get a medication check. And all this, of course, depends upon good family communication. And one of the things we do in our program is spend a lot of time with families on how do you talk to each other? What's a good give and take look like? We might role play listening, for example. I'll give you an example. Here's a handout, looks pretty elementary. This is how you listen to someone. Look at the person, attend to what they say, nod your head, ask questions, check out what you heard. Most of us wouldn't have trouble doing this on a day-to-day basis with our family members, but when someone is getting manic and they're talking over you and they're angry, slowing down and having this kind of measured interchange where you acknowledge each other's viewpoints can really bring the person down for a short period of time and help them listen to reason. Likewise, we teach people, how do you make a positive request? How do you ask for things you want? I'd really like it if you went with me to see your doctor. We at least got an opinion about what's going on, about how we can help, about whether your medications are working, whether they're the right ones, whether he's even the right doctor. We need to have that conversation. But there are good and bad ways to communicate that information. Doesn't mean that just because you talk nice, the person is going to go along with it. But certainly having a base of a good collaborative relationship is, I think, half the battle. This handout, I find, is the one that many families find the most useful. How can they help? Well, they can help the person get to their doctor appointments. They can support the use of medication, which might mean helping with getting refills or paying co-pays, maintaining a tolerant home atmosphere as much as possible. It's very hard when someone's manic and aggressive, but at least from your side, being able to keep conflict to a minimum. Having fair expectations of the person and other family members. And very importantly, keeping regular family routines. As much as it's important for the person with the disorder to go to sleep and wake up at the same time, there should also be family rituals, especially if there's a younger person involved. When do we eat dinner? When does the TV go off? When do all the cell phones get turned off? When does the modem, if there is one, get turned off? All these things ought to be made more regulated so that there's a little more structure around the person's routines. So the family, in other words, is very, very important in making all this work.